Welcome to self-discoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition of Your Health is Your Choice right here at selfdiscoverywisdom.com. I'm your host, Sarah Troy, and my wonderful guest today is Victoria J. Mondloch, MD, and we're going to be talking about your health today, prevent many devastating diseases by this approach: breast cancer, osteoporosis, and even Alzheimer's. So she's preferring health. How is she doing that? She advocates for patients to achieve optimum health as the traditional medical system has lost its focus. Patients want to be off meds and out of healthcare system, but medicine tries very hard to continuously book you into the system with meds. Specialists prefer, no one is helping you find the root cause of your issues. No one is hearing you. Feel 15, 20 years younger than your age by doing foundational blood work covered by your insurance, an advocate for optimum health. And she said, also know that you can prevent many devastating diseases by this approach, which is what we want to do, folks. We want to prevent. We don't want to actually have to always look for the cure. She is an MD, recently retired physician from, what was it, Waukesha, Waukesha, Wisconsin, president and founder of Victoria J. Mondloch, MD, SC. She's also a medical director of Wisconsin Stem Cell, LLC, and with over 35 years of experience specializing in women's health, family medicine, and preventative health and wellness. She also is an author. She has this magazine, Preferred Health, that she features in, and Blossoming, one book, and Full Bloom for another book, which we're going to be talking all about as well. And if anybody actually pays attention to this title, Your Health is Your Choice, which it really is. And we kind of, the mainstream medical likes to believe they're the only choice, but that is not so. And if we can prevent and if we can help heal ourselves, this is what we really have to do, because it's our body, it's our health, and we need to take a little bit charge of it. But half the time we don't know what to do. And this is why we need experts to come in and help us navigate our wellness, our healthness, so that we are not driven to the meds and the operations and all of that. So welcome to the show, Victoria.
Thank you very much, Sarah. Pleasure to be here.
So, it's medicine has its place, right? Most certainly. There are times you need meds, times you need operations and all of that. But really, what we need to do is really pay more attention to that preventativeness of preventing, or even like when we feel our bodies are low or we've gone through something, how to rebuild. Because the daily health of our body is really up to us, but we need to know what we're doing.
Absolutely. And, the way medicine has changed over the past, and I'll just say over the past 50 to 100 years, is we have become more pharmaceutical as a medical system, and that pharmaceutical is chemical.
Yes.
And why is it chemical? Because they can patent those medications. Now, patented medication means they have control, which means they can do whatever cost they want to assign to that medication, which, yes, we want them to recoup costs of research and whatever. But what we've lost sight of the fact is that our body is smart and it knows how to heal itself if you give it the proper tools and resources. And so how do you even find out it may be out of balance? Well, you may have symptoms like a migraine headache. You may have symptoms like brain fog. You may have bloating every time you put one bite of food into your mouth. There are symptoms that are actually signs of things out of balance in your body. And as an OBGYN wellness doctor, I, of course, initially started my career seeing women, but my last 20 years of practice, I was so successful rebalancing women and getting them to feel 15 to 20 years younger than their stated age.
Mm,
They would come to me and say, "Can you do this for my husband?"
mm,
Sure, bring him in. "Can you do this for my parents?" Sure, bring him in. So we had entire extended families that were really learning to A, listen to their body,
mm.
B, learn that they could rebalance the basic foundational four hormone groups, and they would actually come in all excited with for their next appointment saying, "I got my blood results in the mail. I already know what you're going to tell me. You're going to tell me da 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 da.
Mm,
And I'm so excited to meet with the doc because I already know what she's going to say." And they were right more than 90% of the time. So it's empowering
mhm.
and educating, and how novel to feel excited about your
Yes.
health and
Yes.
know that you're in charge because
Mhm.
you know what's wrong. That's what's missing
Yeah.
in the present Western medical system. They just tell you, "Oh, you have this symptom and this symptom." Well, it must be, and they label you, and then you're suddenly on a medication, and you go, "But I have another question." "Oh, you'll have to make another appointment. I'm
I
really
know.
sorry." And it's
Yes.
not designed for the patient to be user friendly to the
Mm-mm.
patient. It's designed to be user friendly for the healthcare system.
Mhm. Mm.
So wait a minute, we pay all this money for insurance or for a healthcare system that we're treated like a second-class citizen.
Yeah.
We aren't heard.
Yeah.
We are given medications we don't want. We don't get an explanation as to why. If that would happen in any other insurance industry, like car insurance, you
Mm.
drop them and go to another one.
Exactly.
Or
Mm.
home insurance, you drop them and go to another one. So we have no choice many times with our healthcare. And the sad thing is that this information is basic hormone balancing, the four hormone groups in your body. But they don't even teach this in medical school.
There's a
What?
lot they seem to teach. I know. I just did a wonderful show actually on periods and menopause and birth control and everything that doctors, mostly, white male men, are not even taught in school and don't know a thing about a woman's body. And so, it's the more we know, the more we're empowered to make the right choices, or at least ask the right question. But how do we
Well,
even know
right,
how to write the right question, right?
right, right. And so if one of the tools, which is in my books, but I'll just show you the tool, um, is if I can help you organize the symptoms that you have. Wouldn't that be a novel idea?
Yeah.
Because you may have 5 things going on. You may
Hmm.
have 10 things going on. When they say to you in the exam room, "Why are you here?" You may get the first two out and you're interrupted. You
Yeah.
may say, "I've got migraines and increased heart palpitations." "Oh, well, that means," and
Uh,
they cut you off and they never let you finish. So you are left without getting the rest of your symptoms out. And they're going to say migraines and heart palpitations. Well, we need to send you to a neurologist for
mhm.
your migraines. And oh my goodness, for heart palpitations, well, you need a cardiology workup. Well, that's two different referrals to two different
Mhm.
doctors. Well, wait a minute. I thought you could help me with this. Oh,
Yeah.
no, no, we
Yeah.
have to be certain. And it's fear
Mm.
medicine. So I'm going to show you very quickly, and I know this won't translate well by camera, but just to give you an idea,
Mhm.
if you had a list of symptoms like this, that you could go down the line and say, "Wow, brain fog things like short-term memory loss, insomnia, poor sleep, hot flashes, night sweats. Wow, there's the migraine. There's increased muscle pain, joint pain. Oh my goodness, increased acid reflux, heart palpitations are in here, bladder misbehaving. Okay, then you've got increased PMS symptoms and abdominal bloating and headaches and constipation, but also loss of hair from your head, gaining hair where you don't want it,
Mhm.
And mid-abdominal weight gain. Well, I had patients mark every single
Yeah.
one of these.
Yeah.
And some of these you don't even realize you may have until you look at the sheet and go, oh my goodness,
I identify. Yeah.
how did they know? So what if you could take a tool like this and mark it before your doctor's
Mm,
appointment? Walk in with your copy and a copy for your doctor. Now, instead of trying to get all of these out verbally, you hand it
mhm.
to them because guess what? It's in writing and you demand it become a part of your chart.
I know, so they can't dismiss it.
They cannot dismiss it.
Hmm.
They are on record as you have
Yeah.
been told.
Yes.
And my approach with patients was always, okay, tell me your top three. And of those top three, with your permission, if I could get rid of them in the next 6 to 9 months, would that be okay with you?
Hmm. Yeah.
Right?
You
All of
can
a
actually get
sudden,
rid of it. I thought it was
right.
permanent, or I'd have to take drugs for it, have something cut off. Yeah.
Well, right. So now we're partners.
Hmm.
It's not doctor patient, it's doctor patient.
Yes. Level playing field.
Let's do this together
Hmm.
with your permission.
Hmm.
Now, all of a sudden, you want to help me help you get rid of these
Yeah.
because you didn't even think it was possible or that they were even related. So know that you live in your body and you know the symptoms you have. So trust your instincts
Hmm.
and use a simple resource tool. Again, it's in the books that I write, but it's a simple tool to help organize your thoughts. You don't want to be fragmented when you get asked a question by the nurse, a question by
Hmm.
the doctor, and suddenly you're being booked for two more appointments with different specialists
Yeah.
that, wait a minute, I've got more to say here. Oh,
And not only that, you're waiting months to see the specialist, right? So,
and then worse of all, is you get to the cardiologist for your heart palpitations, okay? And they say to you, oh, well, we need to do a stress test, which is it comes back equivocal. Oh, well, the next test we do is the percentine stress test, and you have to get a marker in your veins, and we repeat this test. Oh, it's still equivocal. And now we have to do an echo to make sure your valves are fine. And now, well, everything is equivocal. So now we really need to make sure you're not going to have a heart attack. Notice how they just scared you
yes, yes.
in the next 6 months.
Hmm.
So we need to do a cardiac cath. In the States, and I'm just going to say this because I'm in the US, the cost of a treadmill stress test is about $4,000 to $6,000. So let's just
What?
five. Mm-hmm.
What? They're just plugging some things on you and you're going to walk on a treadmill. Oh,
$5,000. Okay. Now you do a percentine stress test, it's $7,500. You're now up to $12,500. Now you do that echo, that ultrasound of the heart, and that's $4,000. So now you're up to $16,000. Now they're telling you you need a cardiac cath, which most people don't understand that you're in the cath lab, but they have an operating room fully set up with everybody scrubbed in case they have to suddenly open your chest. And you're paying for that, whether you use it or not, by the 15-minute increment.
wow.
So that cardiac cath may cost between $12,000 and $15,000 on top
Yes.
of the $16,000 that you've already spent. You're up to $30,000 for a cardiac workup. And then they tell you everything is great, which, you know what? You already knew that.
Yes.
What would my approach be? Gee, there may be some hormone imbalance going on, but an easy thing that may be going on is increased acid reflux. Why would that give you a heart palpitation? Because acid coming up your esophagus, if it gets this high, What's right here?
Yeah. Mm-hmm. Mm-hmm.
Is it going to inflame and irritate the lining around your heart and potentially over time cause your heart to misfire and have palpitations? Sure, it could.
Mm-hmm.
So, an easy way to rule that out is you've got baking soda in your kitchen. I want you to do a half a teaspoon of baking soda in 2 ounces of water every night before you go to bed. And tell me if those palpitations are as the same or are they decreasing? Tell me if the intensity decreases. But meanwhile, we should get some hormone levels checked.
Mm-hmm.
That isn't anywhere near $30,000.
No, no, no. I mean, the States is known for that. We here, of course, in Canada, we've got coverage, right? But still, if you are sent to a specialist, um, it's is months and months or years to actually go and see them. I mean, we have such a doctor shortage here right now that here in BC, where I am, there's a million people without doctors. I haven't had a doctor for 5.5 years. If I need to get prescriptions done or talk to a doctor, I have to phone one. I have 3 minutes and one question.
Mm-hmm.
That's it. So
Mm-hmm.
they're not even there ready to listen to you. All right. There's just next, because they're just coining it in uh,
Right.
every three
Well,
minutes. So
right.
it's the
And
medical profession has become very money oriented. As you said,
yes.
pharmaceutical, push the drugs. I've actually had doctors who've come on here that have been blacklisted for
Mm.
promoting holistic health instead
Mm-hmm.
of going the drug and the operation way and say, no, man, you can't do that. We've got a process. You've got to push drugs, so you've got to push,
Or
medical
you get fired.
treatment. Yeah.
Mm-hmm.
And you can't tell people it's diet. You can't
Mm-hmm.
tell people to change their lifestyle. That's not what it's about. And he said, but that's what the patient needs. And
Right.
I got blacklisted because of it. So, there's a danger in our medical system right now. Absolute
There is.
danger.
And in the States, 77% of doctors are employed like they are in Canada or the UK because that is a socialized medicine
Mm,
system. But make make no or have no doubt in your mind that you are paying for that system through your taxes.
hmm.
And those taxes, they're not going down,
No.
they're going up.
Yeah.
And you're still getting lousy service for healthcare that isn't helping your health. So it is sickness care, not
Yes.
wellness care.
Well, there's more
So
profit in sickness.
there
There's
is,
not profit in health.
correct,
Not for
but
them.
there is a disconnect.
Yes.
Exactly. So I don't know in Canada if patients are able to order their own blood work, but in the US, you can order your own blood work. You can do it online, and then they direct you to a national lab draw station where you can go in and get your blood drawn and those results because you paid for them online. So now you're paying for it.
Right.
But you get those labs you want, the results can come back to you. So now you have control
Right.
of your labs. And so that is a system that we have in place in the States because we're only 77% of docs are controlled by a system or by the healthcare companies.
I don't know whether we can do that or not, actually. I have to look into that. I mean, we do have healthcare coverage. One of our big problems is a lot of doctors are going into private. And so that's why we have a shortage of doctors, and not a lot of people are going into medicine nowadays. So there's a massive onslaught of that. But I don't know if one can actually order that. I have to look at that on the
Yeah,
Canadian
well,
side.
and if there is a private practitioner, then they are not beholding to that system. So
Mhm.
it's likely very similar to what they can do, like what we can do in the States is I was independent and private, worked for myself. So I could order whatever labs I needed to
Mhm.
order on my patients. And they're not unusual labs. They're codable so that insurance companies pay for them.
Mm.
So it's not rocket science and it's not crazy labs. It's the four foundational hormonal groups in your body that run the foundation of your health. So, what are the most important labs to run other than the
Right.
foundational labs? And covered by insurance. And any treatment for it is either natural vitamins or food or things that might require a specific medication if you find you have a thyroid issue. But more importantly is that's at least knowledge. You have
Yes.
that knowledge, and it is your choice with that knowledge to make the decisions for your own health care that are right for you.
Yeah.
Great concept.
Well, I mean, for so long now, our own health has been taken out of our hands. And,
Or
you know,
so we think, or
so we
so we
think, well,
think.
and that, but, and also there are some doctors, it can be very intimidating.
Oh,
You know, my
absolutely.
sister's in the UK, and she, you know, cannot take any nutritional pills or anything like that at all, because it might conflict with her medicine. So they've put the fear in her that she has to have only the drugs. She can't take a vitamin of any kind whatsoever. And so it's a control factor. And for
Oh,
some, you know,
absolutely it
and
is. It's a brainwashing. And
yeah,
so
it is.
I would, whenever, and I'll tell you a quick little story, a patient that when we discovered she had a hormone imbalance we couldn't easily correct, and it ended up with a bad mammogram. And she is a nurse who worked in an oncology ward at the medical college hospital, right? So her boss is actually taking over her care medically. So
Mhm,
there's kind of this conflict of interest,
mhm,
right? Well, so she's coming in to see me, and she had had a lumpectomy, and they put her on tamoxifen, an oral anti-hormonal medication. So she is coming in for her appointment, and I said, I need your hormone levels. And she goes, Doc, I'm on tamoxifen. They're going to be low. I said, I need your hormone levels. She goes, okay. So she got her levels. Now, just for context, I'm going to tell you that 100th percentile of an estradiol level is about a number of 300. Okay, that's the number you'd expect if you were in your 20s or if you were pregnant or whatever. That number is about 300. Well, I got her blood levels back, and I called her immediately and I said, you have to get a hold of your doctor now. These numbers are horrible. Your estradiol number is 250th percentile. You're at 875, and you should be at less than 5.
mm,
So
yeah.
she goes, well, what does that mean? I said, your tamoxifen isn't working for you. Your body's fighting it.
Mm,
And you have to talk to your doctor immediately. So she called back about 2 hours later, and she was in tears, and she said, they don't care. I said, excuse me? She said, I'm on a study and it would disturb the research study.
yes.
And I
Yes.
said,
Yes.
get your husband, and I need you in here tomorrow. I'll make room in the schedule. I will make room. You just tell me when you can come in, and I will build a hole, and we need to talk. So they come in, and I explained all of this to him, and he looked at his wife and he goes, well, what do you think about this? She said, well, they don't check hormone levels, so I don't even know what to think except for what Dr. Mondloch is telling me. So he turns to me and he goes, what do you propose? And I said, well, I don't want her to lose her job, but I do think we have to at least double the tamoxifen. And he looked back at his wife and said, sounds reasonable to me. And she goes, well, I disturbed the research study. And he looked at his wife and he said, do you want to live? And I couldn't have said that any,
Yeah. Yeah. Yeah.
you know? And so she said, well, what do I tell them? I said, you can tell them whatever you want or don't want to
Hmm.
tell them, because your answer is you are on tamoxifen. They
Hmm.
didn't ask you the dose. You
Yeah.
are on tamoxifen. She said, I can do that. So it took us another 2.5 years to get her numbers to come down to less than 100. But she didn't have any further stimulation to her bad mammogram and bad tissue biopsy, her precancer. It was, but it was horrendous
Mm.
that the study was
Yes.
more important than the person.
Yeah.
It's like,
Yeah.
how did it get this crazy?
No, I had fibromyalgia and they put me on this pill and it wasn't doing anything for me. And then I came across somebody else who'd been on the pill and ended up at $30,000 at that point at the dentist, where the pill was actually causing the sockets of the teeth to dry up. And this was the chief, dental person at the university hospital saying this. And I said, I don't want to be on it anymore. And I gave back the pills I had, but I apparently missed a few. And I had to get my medical report from him for some reason. I can't remember. And I read it. I thought any moment somebody was going to knock at my door and arrest me. Because
Oh my
it
goodness.
was horrible what he wrote.
Hmm.
Absolutely horrible what he wrote because I came off that thing and I had the pills back and I, was negative about the drug. And I just couldn't believe you're meant to be there advocating for me. I'm
Oh,
feeling like any moment someone's going to be knocking at the door, come and take me away with what he wrote. And who does this gone to?
I know, right?
Right? Yeah.
And in my professional work, I never found a patient with fibromyalgia that diagnosis stayed with what I did to help get rid of it. Because most of the time, what I found fibromyalgia is that your body could not properly methylate or detox your tissues.
Mm,
So it
mhm.
truly is a matter of abnormal methylation, which is genetic.
I got to write
And
this down. Yeah. Yes.
yeah, and the name of the gene is called MTH, F as in Frank, R. So if you cover up the FR, it looks like mother, and then you
Yes.
cover up, yes.
Mm,
So MTHFR, there are four genes, well, two copies of two genes, so four actual genes that medicine looks for by blood test that tell you if you're missing one or two of those genes. 30% of the population is missing one or two, which means you cannot properly methylate. What does that mean? That means think of going to the gym and you just did a really hard workout and you feel that lactic acid burn, right?
oh God, I feel that all the time, and I don't go to the gym.
Right, because you're not clearing it.
Ah,
MTHFR deficiency means you can't clear that burn and it keeps building and building and building and
so
building
that's where
and
the
building.
hypersensitivity comes from,
Bingo,
right?
bingo.
Because it feels
Now,
like somebody's tearing your skin when they touch it.
right now, you know what the treatment is?
Tell me, I need to know. I've had it 27 years.
Methylated vitamin B complex.
Methylated vitamin B complex.
Right. Now
And what dosage?
the brand that I like is Metabolic Maintenance. Amazon. Super simple. They ship it right to your house. Okay.
I am definitely trying this.
Now I would have patients start with, if they're missing one gene, I would have them take 1,000 to 2,000 mcg methyl vitamin B12. If they're missing two genes, 3,000 to 4,000 mcg. Each capsule is 1,000. Now it also has methylfolate in there, so you get methyl in there twice out of the complex. But does it work overnight? No, you've
Yeah.
got how many decades
Well,
of stuff
nearly
that
three
you
decades
haven't
with me.
cleared.
Yes. Yeah.
So
And
I
it
had a
interferes with
patient,
my life completely.
right? I had a patient that she started seeing me at age 69. And
That's what
she
I am.
told me that was her diagnosis. And so we had other issues going on. Put her on the methylated vitamin B complex. It took about 6 to 9 months, but the elevator door opened and she came out of the elevator dancing.
Mm,
She opened the door, and you know how the leprechaun kicks
yeah.
up and that's what she did at the front desk. And my secretary just looked at her, stood up and applauded,
Yeah.
And she said, and she used to walk in with a cane shuffling.
I have, I mean, I can walk, but I walk like an old lady. I can't do hills. I am asthmatic as well. I can't get down on the ground because I can't get back up again. And I live with pain all the time. Like
What
there's
if we can get rid of that for
electronics
you?
going through my body the whole time. I would
Yeah,
love to because I have
right.
so much to do in life and I've got two grandbabies and it's just deteriorated even more in this 3 decades. It's vitamin B or D, did you say?
E as in
B.
boy.
I am ordering that today. I am
Yes.
definitely because that thing. I always believe there is an answer, but half the time we don't know what to ask. And I always believe, like they say, for every disease, God has a cure a few feet away. Well, I always believe there is something out there, and that clearly. And this is what I've been trying to say to doctors for there's clearly an imbalance in my body. There's
Hmm.
clearly something going on. And yes, I know this was triggered by trauma, right? And the body, when it's traumatized, disease becomes imbalanced and it activates something in your body. And I think my mother had fibro as well. So I think that, definitely running in the genes there. But trying to get anyone to talk about it in a way where they're, oh no, we can't do anything about it. Now, there's pills that you can take, but really it's something you just got to manage for the rest of your life.
You're just covering it up because
Yes.
nobody's doing the root cause to
No.
find out why.
Yeah.
I always said to my patients, I've been the incessant 2-year-old my entire career. I always ask why. And
Yes.
if you don't understand what I'm saying to you, I give you permission to be the incessant 2-year-old back to me. Why? I don't
Yes.
understand. Why?
Yeah.
Why?
Explain it to me. Explain it to me. Where most people, I haven't got, I'm just the professional. Forget it. It is what it is. No, I want to know. I want to know there's hope.
Right,
I want to know there's something I can do. Empower me.
right. And if you realize the diagnosis, which is a garbage diagnosis, fibro means fibrous tissue.
Yeah.
Myalgia means pain.
Yes.
Pain in fibrous tissue.
Yes.
What does that mean?
Yeah. Yeah.
Right? It means garbage. It sounds impressive,
You're
but
right.
it's garbage.
Yeah, because it
So,
feels like constantly that there's a water running through my body with an electric current. Those
mm,
electric eels.
hmm.
That's what I feel like all the time. Like there's a buzz
Mm.
going on. But the biggest thing is exhaustion.
Oh
It's
yeah.
like
Well,
it's like a battery in
your
your phone
muscles,
that's wearing out. It's yeah, and I
yeah,
can't even lift my arms up higher than this, and it's
because they're
it,
overloaded. They're
yes,
overloaded with junk,
yeah,
and you've got to clear the junk. It's like having a hoarder's house.
yeah,
You can't even get in the front door.
yeah. Oh, I am ordering this today. I mean, but that's the thing I always believe, that medical likes to overcomplex things
Mhm.
because it sounds good and it gives them the authority. But I always believe that there is simple answers. Now,
There are.
again, like heart disease, we can replace hearts today and lungs today and limbs today. I mean, medicine is fantastic at crisis or
Yes,
fixing things in the moment, but it's not good at maintenance or diagnosing root cause, right?
right.
It's band-aid, it's drugs, it's let's take it out. Um, Instead of, well, what's the root cause that's causing it? And I
Yeah,
just don't ever feel there's a root cause identification.
there isn't. There isn't. It is disease identification.
Uh-huh.
Come
Yeah,
up with the disease, we've got a pill for you.
yeah,
Wait a minute, I don't want a pill. Well, that's what I've got for you, you
yeah,
know. And I'm sorry, but that's how have we existed as a civilization all these
yeah.
millennia without pharmaceuticals? We really have made it this far without there ever being any pharmaceutical company in existence except the past 200 years.
And
Oh,
yes, let's give antibiotics. I mean, my little my little grandson, 13-month old, who's just picked up the foot, mouth, and
mm,
hand
hand, foot,
virus.
mouth disease.
And
Yeah.
the poor little thing, his mouth is full of blisters, and painkillers is the only thing we can do for him right now, because it's a virus. It has to see itself through. Uh, he's had a number of things happen to him, poor little thing. But yes, medicine has its place. Antibiotics have its place. Broken bones, the way they can put them back together. I mean, yes, it has its place, but it's out of balance. where that's the be all and the end all. You know, when the body has had a major operation of any kind, broken limb, this, that, etc., it needs those proper nutritionals and balance to detoxify the drugs, to fortify the body, because otherwise you're tilting and you always feel out of sync. You always feel,
Mhm.
going off, veering to the left or the right, and you don't feel you're ever going straight because it's too much emphasis on that. And yes, if you look at the past, um, the food that they ate didn't have the added chemicals on it, didn't
Mhm.
have the added this. You look at a label these days and what language is this? I can't identify it. I have no idea what it is. And the amount of sodium they put in everything and sugars that they put in everything. And it's like, what are you trying to do? Kill us? Maybe you're
Yeah.
working with the pharmaceutical company because you being sick is profitable for them. My
Mm.
doctor actually did say to me when I got onto these nutritionals, and I hadn't seen him for a long time, and I had to take my daughter to him, and I had told him about these nutritionals. He said, "What do you want to do? Put me out of business?"
Yeah.
That was his reaction. Later
Hmm.
on, he was telling me about echinacea because I was
Uh-huh.
big one of, oh, have you tried echinacea? I said, I'm the one that told you about it. Remember, it was going to
Hmm.
put you out of business.
Hmm. Right, right. It's mind-boggling that we as doctors take an oath to do no harm.
Yeah.
Yet we get bamboozled, we get brainwashed, we get told it's this way or the highway.
Yeah.
Well, doctors can make their own decision. And so
Mm-hmm.
in Canada, they are making that decision. They are leaving the public health system and they
Mm-hmm.
are going independent. And in this country, we all started independent, and then the hospitals and the insurance companies started buying the physician groups, saying, we will manage your back office so you can just do doctor things
Yeah.
and we'll manage the back office. Well, down the contract, it said, we own you, but nobody
Yep.
read that far down.
Yep.
So,
Yep. I have a doctor, Dr. Timothy Teal, ears, nose, and throat. He has been
mhm,
blacklisted and
mhm,
he's not allowed to practice as a practitioner anymore because he realized that diet was causing many of the problems. I
mhm,
would have people cut this out, change that, do this and do that, and they got better. And they go, but hang on, where's the prescription? Where's the
mhm.
operation booked? All right. How
Right,
come you're not pushing the drugs? Not because it's not needed. This is what's needed. As a doctor, I'm here to serve my patient. No, no, you're not. You're here to serve the bottom line. And that's what it's become. It's become a business.
right, right. And that is not the oath that we take.
No.
So So I'm sorry that that happened to him. I had something very similar, threatened and happened to me, but even as an independent. But the point is we all need to know your body, and
Yes.
you know when your body is out of balance.
Hmm.
You simply need somebody with knowledge to help you work through your issues. And how do you work through what's going on is you dig to find the root cause.
Yes.
And that should be intuitively obvious.
But shouldn't that be the first thing a doctor looks at? What's the root cause?
It should be, but that bottom line of have you sent this patient for how many referrals and how many other surgeries or
Yeah. And
procedures have you set
bankrupted
them up
them
with?
that they can't afford to live anymore.
Well, yeah, your
Yeah.
your quota hasn't been met this month, so you're getting a
Yeah.
pay. You do it again, you're going to get your vacation docked. You do it again, you get fired. So it's it's real,
Mm.
and but most patients don't understand the total disconnect between the patient's expectations and the healthcare's
Yeah.
expectations. So I tried to make sense of it for women by writing books. I
Hmm.
did consented research with my patients for the past 20 years, and I literally developed the graphs of where hormone levels should be in women by their age. In other
Mm.
words, are you age appropriate
Mm.
for your hormone levels?
Right.
And the same with men, although I haven't written the men's book yet. But in women, the two books I've written are about the two most forgotten women. The adolescent, because nobody pays attention to the adolescent.
Yeah.
And we
Yes,
all
it
know
is.
an adolescent that
Yeah.
has hormones. imbalance and perhaps an eating disorder.
Mm.
And they don't understand the symptoms that may be causing a lot of their hormone imbalance manifestations. So they don't know bloating is low progesterone. They don't know that increased heart palpitations or heavier periods is an estrogen dominant situation. They have too much estrogen and not enough progesterone. So, and they don't know that they may be in the beginnings of polycystic ovary, which is genetic, but it needs to be managed and
Mm-hmm.
understood so you know what you're in for.
Mm-hmm.
So, but I go through case studies, I go through the research, American and European, and I also have a chapter at the end of the book, how to talk to your healthcare provider.
Mm-hmm.
So I'm giving you the resource
Yeah.
that you need. And it's written as a mother-daughter guide
Mm-hmm.
because no adolescent is an emancipated minor where they can speak for themselves.
Exactly.
So they
Yeah.
need to engage their parent with this journey, and their parent and them need to know the information in this book. And the second forgotten female is that teen's mom or grandmother.
Yes.
So
Wow.
full bloom, right?
Yeah.
Right? That's for the perimenopause, menopause, postmenopausal woman. So again, I dispel the myths and tell the truths about what hormone balance really is and why we've been handed a line that hormone is bad for us in menopause because it suits the cancer industry and the hospital industry with increased tests and chemotherapy and unnecessary cancer that could be prevented by hormone balance and hormone replacement. And the difference in the American versus the European research is a 180 difference
Mm-hmm.
because Americans didn't look at bioidentical hormone and Europeans did.
Yeah.
And so that discrepancy needs to be explained as to why there's a difference. And again, case studies. And again, a chapter in the back of the book, how to talk to your doctor.
Mm-hmm.
So I need women talking.
Yes.
Need women
Yes.
having coffee clutch,
Right.
having book clubs,
Mm-hmm.
having sit downs with their family, with their daughters. I need church groups
Mm.
talking, schools talking. We need to know and therefore advocate for our own health because only we live in our bodies.
Yeah.
Only we can tell a doctor how bad our cramps are and
Right.
what we think this is because, and this is why I want this blood testing done. And in the States, if they say I can't go there, then we can at least go there and order our own blood work. So
Right.
it would be really interesting to know if there is a workaround in
Mm.
Canada to be able to order your own blood work.
Yes, I don't know because it would be go to the doctor and then you don't own it. That they're only going to tell you what they want you to know.
Well,
So
right,
I
but
don't know.
again, if it's online and you could do it online
Yeah,
with an
I am
inch in
going
the
to
rough,
definitely do some research to find out about that because that's empowering to know your own blood work. Even if you don't completely comprehend what it's telling you, at least you have the data there to
right?
go to the doctor and say, this is what my blood work is telling me, right?
Right, right, exactly. And the information is knowledge and knowledge is
Yes,
power.
yes.
And so we need to be empowered
Hmm.
and we need to be our own advocate that this is information I own. This is information that this book tells me. And this is what I want based upon the information in this book. Oh, by the way, Doc, you don't have this book. Let me leave my copy with you.
Yeah,
I'm
exactly.
sure you're going to want to take a look. I've earmarked the pages that I think you really need to take a look at.
Right. Or here's this podcast that you need to listen to.
Mhm.
And just as, people have book clubs, and of course, the first book for people listening is Blossoming. The other one is Full Bloom for the senior one. But, as we have book clubs, I tell to people have podcast clubs, right?
Mhm.
To either listen to the podcast alone and then come together. What did you all get from it? And start a
Mhm.
conversation, or listen to a podcast together in a group, take notes, and then share afterwards. The whole point of doing this is education, inspiration, invitation to do whatever it is you need to do that you're inspired by, but take action. Take
Yes.
action. Now you know, you don't unknow it. What are you going to do with the knowledge? If it
Hmm.
isn't relevant to you at the present moment, then share it out with someone else that you know it could be relevant with. It's not just a nice piece of entertainment, it is powerful wisdom that is needed in someone's life. And if by sharing it, you are empowering somebody that's going through something, like what I've learned today with fibromyalgia. Do you know how many shows I've done on fibromyalgia and the people suffering on it? If I can, in a few months from taking this and say, by the way, fibro left
Mm,
town, look how empowering that is,
right.
right? So it's imperative that we talk, that we
Yes.
share, that we ask. Do not feel silly because you don't know the answers. They don't want
Doctors
you to
don't
know the
either.
answer. No. It's more importantly, learn how to ask the question. That's the
Right.
importance, right? And sorry, the
Bless you.
importance is that our health is our choice in the basis of that we need to get as much detail and fact on what's wrong so we can make a choice of which avenue to take to put things right.
Mhm.
But if we
Right.
don't know how to know what's wrong, how are we going to know where to go to put things right? And half the time, we're given that diagnosis, like when I was given fibro. No, it's a disease. And sorry, there's no cure for it. It's only manageable. And that's it.
And my statement to you is you were handed a load of bunk because it's not even a real diagnosis. I don't believe that diagnosis even exists because what it is improper clearing of toxin from your tissues, which is a normal bodily function if you had all of the genetics there for your body to do it.
Right.
So nobody's looking. I call that
No.
the teenage look. You know, when you tell your teenager or your kids to go up in the closet and find me, da da da. And all they do is open the door and go, nope, not in here. Close
Yeah.
the door.
Yeah.
Well, I'm sorry, that wasn't a look. You just open the door. If I tell you you don't come down until you bring me da 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 from the closet, that's a look. Now you're in there and you're looking for
Mm-hmm.
something
Mm-hmm.
and you're on shelves and you're looking for that root cause. Now you have a process in place. So insist on the process
Yes.
and know that you can check for the MTHFR gene by blood work. But if you suspect it, the treatment is the same, whether you
Yeah.
have it or not.
Yeah.
And the harm of taking a methyl vitamin B12 is that you get more energy. What's wrong with that?
Oh, excuse me? Anybody not want to have more energy? Right?
Right.
You know,
There's
I produce
not a
these shows,
downside.
I'm producing books, I've got grandchildren, and yes, I would love to have more energy instead of being depleted quarter of the way through the day. And let's face it, with the diet that we have today, emotional, physical, spiritual, and content that we take in every single day is toxic. If we're not getting rid of those toxins, where even our emotional toxins can affect our body, right? Our spiritual ones, the disconnect or the fear ones that we're driven all the time, it starts building up in our body. And if we're not detoxing it, right? And for men, my fibromyalgia, I'm sure cancer and heart disease and all sorts of other things start manifesting from it. From the dis-ease comes the disease. And so really, when you think about it, everything needs to be detoxed of what's bad. That's the reason why we have poop and pee. It's to detox what the body doesn't need. But if the body system isn't working properly to diminish that properly, then the body is holding it in. And I've been holding it in now for 27 years, and I don't want to hold it in anymore. So
And you have a plan now.
I do, believe me, Amazon, here I come. Absolutely. And the fact that you can buy it on there, I hope I can buy it in Canada because it might be different. So hopefully it's a vitamin B. So hopefully it will, but I am definitely getting on that and going for the high dose because I'm
Hmm.
going to assume I'm up there.
But don't
Definitely.
start at that because
Work
it's
my
like
way up.
taking too
Right.
many energy drinks all at
Right.
once.
So do a
So,
thousand, then two, and then three, build it up.
exactly.
But yes, I would love to get rid of these toxins because it doesn't just affect your health, it affects your mental health, it affects your well-being health,
Mhm.
whatever you've got, whatever the challenge is. And we look at diseases like fibromyalgia, myofascial pain, and we look at all these other things that have come up today, and I go, when did they come about? And now all of a sudden they seem to be rampant.
Mm,
Why are they rampant? Well, we didn't used to take in so many toxins. Our food was less but purer, right?
mhm.
We didn't have all these chemicals of everything that we put on our body, in our body, digest. All of this type of stuff just builds up and builds up. And if we don't disperse it properly, it's literally rewriting our DNA.
Right. And that's what happens with wheat and the
Mm,
wheat seed
yeah.
in in the US. There is no wheat seed that is commercially available to grow wheat that doesn't have the pesticide that's been incorporated into the DNA, which
Yes.
is why so many people in the States have a gluten
Yeah.
intolerance. They can go to Europe, eat the same wheat
Mm,
products, but they don't have a gluten
yeah.
insensitivity. They won't get a rash on their skin because that was banned earlier in Europe and it was not incorporated into the DNA.
And that's the thing, they'll say, oh, no, we're not spraying with Roundup anymore. No, we've just incorporated it. And this is the thing, they're
Mhm.
sneaky. We've done shows on the spraying of Agent Orange, quintessentially, what's out there. And when we look at a lot of cancers today, this cancer, that cancer, well, where did this come from? And again, you've got to look at just back to the labels that you read. If you can't pronounce it, don't buy it, because that means it's a chemical and you have no idea what that chemical is going to do to you. But when you see two or three chemicals in it, and then
Mhm.
people forget the biggest organ you have is your skin. So all
Mhm.
that cream and soap and shampoo you're using, the sulfate in there, God, I used to know the names, I don't anymore. Um, the antifreeze and all that other stuff. I mean, what was it called? I'm sorry, I've gone blank on the name, but I know that back in the day, they used to put it's like an antifreeze. They'd use it on the airplanes to stop the windows from frosting up, and they would put it in the oil in the fries so that the
Mm.
oil would last longer. I can't think of the name at the present moment. Sodium lauryl sulfate, but then there's the other one. Um, but yeah, and to make the oil last longer, so they wouldn't have to change it so much. Well, who's digesting that?
Mhm.
Uh-huh.
We're not digesting it.
Or not digesting it is the better point. And this is why, bloating. How many people do you know suffer from bloating? Extended stomach, constant, backfiring and everything else. It's because we're not digesting that food because our body really doesn't want it because it's too chemicalized.
And you cause just incredible GI tract inflammation, which if something is inflamed, it isn't going to absorb anything either.
Right.
So whatever you put in just gets passed on through and you pass it out.
Yeah.
And so people wonder why there is poor absorption. Well, it's based on the inflammation of what you're eating and what are the chemicals in the food you're eating.
And this is why, I do anticipate this is going to take a long time. I mean, our cell structure changes every 3 months, but, just the sheer battle of the absorption of the bee, of
Mhm.
getting into the system, it's going to take a while before it finds its little way in there. And then it's got a lot of work to do with the detoxification before the fortification. So,
Right,
this is another thing we're taught that go to medical, they give you a pill and you're fixed. Whereas when you look at something natural and holistic, it takes longer, but it gets the job done, where the other one is
right,
just masking it.
right. And I work with a product that has an organic cat's claw in it, which is Mother Nature's
Mm.
ibuprofen for
Yes.
anti-inflammatory action. And coupled with a collagen and coupled with an antioxidant more powerful than vitamin C, it's an amazing way to take down gut inflammation. So there are products out there that are available that people can choose to use. They simply have to be made aware of them.
That's the problem. It's the awareness. And if you do go into a health food shop and I want something for this, all of a sudden you're walking out with 7 bottles. And
Mm,
it's like, I've got to swallow all of these things. Well, which one goes with which one? How much on this one and all of that? And it's like,
mhm.
I've been sold but I really don't know what I've bought.
Right. Well, and that there are so many of those things, and they'll just tell you in the store, oh my gosh, you need, like you said,
Yeah.
7 things. Well, what if you could combine
Yes.
the three of the best?
Yeah.
And so those are some of the other products that I also represent. And I believe that, on your site, you've got my website
Yes.
and
Oh, yes.
my email. So please, if anybody is interested, please contact me, because I'll be more than happy to share. An hour is a long time, but not long enough.
No,
So,
no, it
yeah.
scratches the surface of at least finding, the where the root line is. It's not getting to the
Mhm.
bottom of the root, but the thread going to it. And yes, if you give your website, please.
Yes, it is the HTTPS like you start most with. But then it's no periods or anything else. It's Dr. Victoria J. Mondloch.com.
Mondloch, Mondloch, .com. And of course, they can get hold of you at vmmondloch at Gmail. You're on LinkedIn,
I am. Mhm.
Victoria Mondloch. We don't pronounce the D, but the D is there, Mondloch. And of course, you can buy the books, Blossoming for the youngsters, Full Bloom for us seniors, right on Amazon. And also, you've got this Preferred Health. Is that your magazine, or were you featured in that
No, it
magazine?
was it was a feature that I was put on for Top Medical Director of the Year.
Wonderful.
Mhm.
This is what I love doing with this, and this is the reason why I started this channel, Your Health is Your Choice, is that I'm not knocking doctors because many of them go into it for the right reason, and then their hands get tied by the system, or it becomes capitalization and not a health practice. And there are so many ways that we can take care of the health. We can work with doctors when we need to, but we can also take charge so that we don't need doctors. And
Correct.
get to that point. But we do need to understand our bodies and take ownership and pay attention, learn to ask those questions. As I said, I just had a wonderful woman on, talking about menopause and periods and people being able to get the right pill. And then like that the pill is going to be different if your ethnicity is different because your body absorbs it in a different way. And then with menopause, what you need to do. And she started a whole program and project there where people could buy it and get it on medical if they couldn't afford it.
Mhm.
Get it other ways because how many times do we see people getting pregnant because they didn't think they had access to the pill, or having bad periods, or having menopause because the things she talked about, I didn't go through when I had menopause. I just went through it. Didn't know you
Mhm.
needed estrogen, because nobody talked about it. And this is
Mm.
the thing, we can prevent so much and we can undo so much if we talk about it. And
Right.
that's the important thing. We've got to
Right.
talk about it.
Right. Right.
Blossoming for the youngsters, all coming up there, and full bloom. There's your full package, right?
Mhm.
You've got kids, you get it, you get the full bloom to know what you're coming up with, or if you've got grandkids, you get the blossoming and you read the full bloom for yourself, right?
Mhm.
And when we know what we know, we're more empowered to ask the right questions and also to understand whether we want to accept that answer or not,
Correct.
right?
It is your choice.
Yeah, absolutely. Your health is your choice. And
Mhm.
the more we're empowered to understand that, take ownership of it, honor the vessel that our beautiful spirits are in, right? The better our lives will be. And that is the thing. We want to have our lives live fruitfully. We're here for a reason. We're all here for a reason. And we can't fulfill that reason if we're constantly lethargic, sick, battling illness. We're just not living up to our best selves. And so let's all be our best selves by listening, learning, and applying. So thank you so much, Victoria, for being here today. I am
My
mind
pleasure.
blown on what I've learned here today. I want to know more. I'm going to find out if I do, folks, if I do find out that you can actually get your own blood thing here in Canada, I will put it actually on her show page. So for the link for Canada and knowing how to do it as well. Um, but if not, ask your doctor. I want my blood test for my hormones and I want the results. Don't just tell me them, print them out. You have the right to ask that. They don't
It's
have to
your
write.
information.
It's my
Correct.
information, and the Information Act protects your information. And you say, I want a copy.
Mhm.
And so you know what to do. And then you serve people, obviously, in America. Can you serve people anywhere else?
Well, again, I can give advice. I
Hmm.
can give my balancing,
Hmm.
information. I am not able to prescribe anymore. I am retired,
Right.
but the information is invaluable because that
Yes.
information can be taken to your prescriber.
And so it doesn't matter where anybody else is in the world that's listening to this. You've got the
Doesn't matter.
wisdom and you're ready
Mhm.
to share it.
Right, right.
Excellent. Reach out, have a chat. I know you've got questions, but get the books first, right? Read the books. As I said, pass this podcast around. Everybody get together and go, I didn't know that. I didn't know that. I didn't know that. What are we going to do about it? And change does not happen until we demand change. And if we as citizens say to the pharmaceuticals, to the medical practice, no, we are not accepting the way you're doing business anymore. I am not a product. I'm
Mhm.
not your bottom line. I'm a human being. Treat me with dignity and respect and do your job. And we need to speak out on behalf of all of the doctors that do want to serve us, that aren't serving the bottom line, so they don't get penalized for looking after you in any which way they see fit. So
Mhm.
without the drugs and cutting
Yes.
something out. So thank you
Thank you
so
so
much.
much.
Oh, thank you.
Absolutely. I so appreciate the opportunity to be here with you.
We've learned a lot here today. It's been absolutely wonderful. And uh, I hope many people are going to reach out and get their blood done, find out about the hormones. What do I do now, Victoria? Because
Mhm.
that in itself is empowering, knowing
Mhm.
what your blood hormone is, where it's out of sync. And then it's just a question of getting yourself back into balance, which
Right.
is imperative. Well, imagine how many people would feel so much better in life with that. I know
Mhm.
I'm going to be. So thank you so much. Until next time, folks, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tag at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration, it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.